And you may be wondering, well, what's that going to do with Parkinson's disease, and why have some of you been enrolling in some of our Parkinson's disease study? Well, the clue, of course, came from the slide that Professor Hughes showed you, indicating that there is an increased risk for people who carry the Gaucher gene to develop Parkinson's disease. And I'm going to tell you a little bit more about that and why it's important, not only to know that, but why it's important also to understand it in order to develop new treatments, particularly for Parkinson's disease, but also for Gaucher disease. So I'm going to tell you a bit about Parkinson's disease. Some of you may know a bit about it already, but over the next 10 or so minutes, I'm going to tell you what the problem is, generally, what the disease is, and how we recognize it, what the causes are, and then the clue that has given the opportunity to really think in a completely different way about Parkinson's disease, and just a word about the future. So, Parkinson's disease is the second commonest, what we call neurodegenerative disorder, neurological disorder, after Alzheimer's disease. So it's quite common. In the UK and in other countries now, the lifetime risk of an individual developing Parkinson's disease is 4%. So there are almost 250,000 patients with Parkinson's disease in the UK. And for those who voted Remain, there are 2 million in the EU. It is estimated that by 2030, the world's population of Parkinson's disease is going to double. And the reason behind that is that people in China and people in Brazil are now reaching the age when they will develop Parkinson's disease. Because before that, of course, the lifetime the lifespan of those individuals was less. So it's the world aging population that makes Parkinson's disease so increasingly common. Now, how do we recognize the disease? Well, if you're really, really sharp, you can identify some symptoms many years before the disease is diagnosed. These symptoms are very subtle, and they're a bit non-specific. That is to say, they can occur in many different things. But when you look back, some patients say, I had that many years ago. So one thing is loss of sense of smell. So the sense of smell of people starts to deteriorate. Now, it has to be said, it gets less as people get older anyway. And if you've got a cold, or something else wrong with the nose, then of course your sense of smell will go down. But many years before, maybe 10, maybe more years before Parkinson's disease is diagnosed, people start to lose their sense of smell. They also develop something called a dream sleep disorder, where they act out their dreams. So normally when you or I sleeping, we're paralyzed when we dream. This is so you don't shout out and attract all the animals thousands of years ago that would have come and eaten you. So it's very useful. But in a particular sleep disorder, you're not paralyzed, and you act out your dreams, and you shout and lash it out. Now, you wouldn't know anything about that, but your bed partner does, often showing a good bruise in the morning. So that can come on many years before Parkinson's disease. And there may be some depressive symptoms, and there may be constipation. Of course, these, as you'll appreciate, are quite non-specific. But you put all of them together, and you start to think, is that person at risk? But you cannot diagnose Parkinson's disease until there are 3 particular clinical features which are identified and confirmed by a doctor. Slowness of movement, stiffness and tremor. And those are the 3 main features that allow people to diagnose Parkinson's disease. So it doesn't matter about the so-called prodrome, you haven't got the disease until you have those 3 cardinal symptoms. So what's the basis of Parkinson's disease? Whereabouts in the brain is it? So this is the brain looked at from the side and opened up a little. So what you can see here is something called the basal ganglia. The basal ganglia is the autopilot of the brain and body. So it allows you to do all sorts of things at the same time, walking and talking. And all sorts of other activities, writing, things that you learn to do and you develop a pattern for. Playing tennis, playing golf. All these sort of things become patterns in your basal ganglia. But Parkinson's disease begins in a part of the basal ganglia called the substantia nigra. This is where the brain cells sit that help to run the autopilot. And these are the ones that start to die off in early Parkinson's disease. Now, you can see that in scans. So once a patient has been diagnosed with Parkinson's disease, you can do a scan which effectively looks at their dopamine levels in the brain. And this is a patient who's just been diagnosed with Parkinson's disease, and you can see it starts on one side of the brain, which is, of course, the symptoms of Parkinson's disease start on one side of the body. But as time goes by, the level of dopamine declines on both sides. It declines quite rapidly. So, untreated, this is what we see in Parkinson's disease. You can see the level of dopamine declining. And how do we treat it? Well, we know that the basis of Parkinson's disease is loss of those dopamine-containing cells. Dopamine is used as a sort of oil for the autopilot engine. And so we can put dopamine back. And we can put dopamine back with tablets in many different ways. We can put the sort of raw dopamine back, which is converted in the brain into the type of dopamine that's used by the brain. We can make special drugs that interact directly with what we call the dopamine receptors. This is the other part of the brain that dopamine needs to connect to carry messages, and so on. So we can treat the symptoms of Parkinson's disease quite well. Our problem is that the treatment really isn't getting to the cause of the disease. So we can treat the symptoms, but we can't get to the cause of the disease with this treatment. This is why everybody is really focused on trying to find out what the cause or causes are and how can we deal with those. So, what are the causes? Well, 20, 30 years ago, people used to think, rather naively, there was one cause of Parkinson's disease. It's quite clear there are many different causes. Probably the most important causes are genes. These are the genes, your chromosomes in all your cells. And whilst only a very small proportion of Parkinson's disease is hereditary, maybe only 1 in 20 or 1 in 10 patients have a family member. The majority, although they're caused by the genes, are not hereditary. This may sound a bit of a paradox, but it's because not all the factors in your genes are inherited. Sometimes it's a combination of factors in your genes. But anyway, the most important causes of Parkinson's disease identified to date lie in the genes. And some of these cause Parkinson's disease, and others merely increase the risk of Parkinson's disease. Now, there are lots of them, these genes that cause Parkinson's disease. So all those in the top left-hand corner actually actually do cause Parkinson's disease. These are all different genes, all now identified to cause Parkinson's disease. They're all rare. They cause the disease, but they're very rare. I bet you no one in this room has one. These genes down here are much more common. Much more common. But they don't cause the disease, they only increase the risk. Ever so slightly. Ever so slightly. But right here in the middle is a gene, the Gaucher gene. You've just been hearing about Gaucher disease. And this is the gene that causes Gaucher disease. And we now know there's an incredibly strong link between the Gaucher gene and Parkinson's disease. And Professor Hughes mentioned that it came to light because it was clear that more relatives than you would expect of Gaucher patients were getting Parkinson's disease, as well as the Gaucher patients themselves. But let me finish off on Parkinson's disease and causes. So we talked about genes, we talked about the environment. Well, we haven't really, but there aren't any environmental causes of Parkinson's disease. But there are some things that influence your risk. If you smoke cigarettes, and the more you smoke, the less your risk of Parkinson's disease. If you drink coffee, a double espresso a day will significantly reduce your risk. So when you go abroad on holiday and you see all those people in the morning having a double espresso with a cigarette, you know that they're working hard to prevent Parkinson's. It's got nothing to do with enjoyment. Appendectomy early in life, below the age of 20, is also associated with reduced risk of Parkinson's disease. The reasoning behind that is quite complex. I can tell you at some other point. So those things decrease, but these things, like being a farmer or being in contact with pesticides or herbicides, can increase your risk, but ever so slightly. Now, the clue. So we've sort of already suggested what the clue is, the link between Gaucher disease and Parkinson's disease. But here's a couple of reminders, okay? So the Gaucher gene, we'll call it GBA for short. This is the gene that causes Gaucher disease. The gene produces an enzyme called GCase, right? Because all genes produce something, and that GBA gene produces GCase. Of course, the GCase activity is reduced in Gaucher disease. That's why people get the disease. But what's so fantastically exciting in sort of scientific way is that the same defect in Gaucher disease, the GCase enzyme deficiency, the washing powder, is reduced in Parkinson's disease. And that discovery was made here and helped create this link between this disease that is really quite rare, Gaucher disease, and Parkinson's disease, which is really quite common. So that's the clue. A little bit of science here. Now, this is looking down a microscope at the Parkinson brain. The Parkinson's disease brain cell, when you look down the microscope at that substantia nigra in the autopilot, you'll see that the cells contain this big blob of stuff. It's actually a big blob of protein. The protein's called alpha-nuclein. And this is exactly what Professor was just telling you about when you saw that picture of that kitchen with all those rubbish bags in it. This is what's happened to this brain cell in Parkinson's disease. It's got that, and this protein spreads its way all through the Parkinson brain. It's called alpha-synuclein, is its name. And it's so important in the cause of Parkinson's disease. And here's the link, the clue, the excitement. Because like in Gaucher disease, And like in the Parkinson brain, where the enzyme is down, the washing powder isn't working properly, and you get a buildup of the protein, we also find that a buildup of the protein by any route will also lead to a reduction in the enzyme activity. So you get this vicious cycle which amplifies over time and through the brain. So the idea is, if you can break that cycle by increasing the enzyme activity, improving the washing powder, you'll get rid of the rubbish and clear the brain. So that's the idea. That will slow the progress of the disease if you can clear the rubbish. So our idea is to increase the activity of the enzyme, the washing powder produced by the defective ganglia gene, in order to reduce the synuclein levels in the brain and slow progression of the disease. So that's the idea, and you can actually test that. So you can model Gaucher disease, Parkinson disease, because of the defective enzyme activity in human brain stem cells taken from the skin. So we can take skin cells and turn them into brain cells. And you can then test to see if increasing the activity of the enzyme reduces synuclein. It does. You can make flies with that GBA gene, the defective washing powder. And these flies can't fly. But if you start to give them a drug that increases the activity of the GBA, the washing powder, they recover and fly. Same with fish, and the same with mice. So in all of these models, the idea has panned out. It looks like a good idea. So we need to make a step to humans, to patients. We've tested it on everything we can do so far, this idea. But we now need to move to patients. And the good thing about this project, if you will, is that we need to include patients with Gaucher disease. We need to include their parents and relatives who may be perfectly normal, just their relatives. And we need to include Parkinson patients. So, it's an extraordinary story, and it's actually a story that's been going on for 8-9 years. So it's moving very quickly. And it's moving very quickly, we think, towards being able to test these ideas in patients and to come up with some new drugs for these diseases, and in particular to slow down Parkinson's disease. So it's a very exciting period, and we're really, I think the scientific community is really galvanized by this process, and I know that the patients are too, which is why you're here. And I'm going to stop there, and I'm now going to move to Dr. Marco Toffoli, is helping to run the Rhapsody study. And Marco is going to tell you about how we're trying to translate all these new ideas into something that's going to make a difference.